Very good afternoon, everyone. I thank you all for being here today. It's a privilege to address such a gathering, especially for a cause which is close to our hearts, the health and well-being of our women. When women's health is prioritized, families thrive and communities rise. Despite of this, we are seeing that women do come to us in late stages and we are losing them for cancer in advanced stages. Now here we are talking about two important cancers in women, that is ovarian cancer and endometrial cancer. Most of you all would have heard ovarian cancer is a silent killer. But let me tell you, it is not that silent. It does give away some warning signals like abdominal discomfort, bloating sensation, then unable to eat well. And most of these patients, they think it is some gas problem and they end up going to a medical gastroenterologist who gives them some prescription. The symptoms persist, abdomen becomes bigger, and then they realize something is wrong, they go for the scan, and then they realize that ovarian cancer is an advanced stage. So again, as I said, it's not a silent killer, but it gives us silent symptoms there. So what we have to tell every lady is that if her symptoms persist and they do not subside even with the simple medications what they have been given, then yes, they have to come and get thoroughly evaluated. Most of the ovarian cancers we have seen with as the age increases, the incidence increases. But again, we do see a wide range. It can happen anywhere from 50 to 65 years. It is very, very important that when people come to us for screening, taking a good history. Because if there is any family history of breast cancer, or she had an ovarian cancer, or this lady had a simple non-cancerous condition called endometriosis. Endometriosis is a very, very common condition in young reproductive age group women. But what most of them fail to understand is that this endometriosis tomorrow can turn into cancer. Recently, we had a lady known to have endometriosis for many years, and she took alternative treatment thinking it will subside. She went to a lot of doctors where they said it is a simple endometriosis. She was a CEO of a company and she came to us when she was in stage 3 ovarian cancer. When I was discussing with her, she said, "Doctor, nobody told me that this could lead to cancer in the future." Yes, the incidence may be very low. Not all endometriosis will lead to cancer. But why is it important that we take a thorough history and we have to counsel those patients is that so that they're regularly following up and we can identify those early signs and symptoms, be it symptoms or radiology imaging, and we could have picked her up in a very, very early stage and the treatment would have been much, much simpler for her. Now coming to the other one is endometrial cancer. Now if we see incidence of obesity is really increasing in India. Again, women who have had early period, again, why does that happen? Young girls who are obese, they have hormonal disruption, so they have early period. Women who have late menopause, again, that is again indirectly related to possibility of obesity. Women with diabetes, these women are at increased risk of developing endometrial cancer. We see young girls these days with a condition called polycystic ovarian disease. Again, it's a very, very simple and common condition most of the girls will go through. But what counseling has to be done is that PCOS is a metabolic condition. So that has to be identified and addressed well. Because if you don't nip it in the bud, then yes, tomorrow that girl may end up with an endometrial cancer later in life. So these are the two important, though the symptoms are there. With endometrial cancer, most of them, they come to us with irregular bleeding. And I've heard patients saying, my mother said, yes, it happens. The neighbor said it happened to her also. So what we are here to tell is that please let these women not ignore those subtle symptoms. If they are persisting, yes, they have to get it checked. So early detection. Now, if again, as I said, when there's a delay in diagnosis, it costs us something valuable, that is time. Time is very important because we can catch them early. If we miss that time, again, we can end up having these women in advanced cancer. Now, EndoCheck, why is that we have come up with this is that it is just not like any other lab test or anything. Here, we are going to have these women have a thorough consultation, proper history taking, and we risk prioritize them who are at high risk and who are at low risk. And we do a simple transvaginal ultrasound. Most of the health checks what are available, they do the reverse. They do a blood test called CA125, which can be elevated in various conditions, and then they come to us saying like, they don't have an ultrasound but CA125 is there. So that's a very wrong way to do. So the best is, again, as I said, a thorough history taking. Did you have early period? Did you have any polycystic ovary in your young age? Any cancers in the family? Do you have diabetes, hypertension? We evaluate the patient thoroughly. And then we kind of like advise them to have a transvaginal ultrasound. Based on what we find, yes, lucky enough, most of the time we do find if we do it correctly in a precancerous condition. So EndoCheck is just not a tool, but this is an opportunity for us to educate women, tell them what are the risks that they are, and yes, when we identify the high risk, we keep them under close observation, because it is not general. Once a year you do some blood tests and come back. Once a year you do your health check. No. High risk women, they need to be closely monitored because they may need an ultrasound once in 6 months and not once in a year. And this will happen only if there is a proper consultation and proper history taking. So our message to women is that do not ignore even a minor symptoms. Do not brush it away saying this is just a minor, everybody has it. Because we really do not know who has a simple condition, who has a precancerous or a cancerous condition. So we are very happy that we are coming up with this initiative to take this bold step and to protect our women, educate them and screen them and catch them in an early stage, because we know when we treat them in an early stage, we have various options, especially young women, fertility preservation surgeries, or young women when they have early stage cancers. When we treat them, the lifestyle is much better than in advanced stages.
Good afternoon, everyone. So I'm a radiologist at Apollo Hospital, Banarghetta. This EndoCheck program is a proactive screening program that is initiated by Apollo Cancer Centers. And this is basically for early diagnosis of endometrial and ovarian cancers. So these two cancers are one of the common cause of death and ailment affecting our Indian women. So early diagnosis helps to contain the disease before it spreads. So there is staging of the diseases. So when it goes to stage 3 or 4, the treatment options are less. They become more aggressive with equal side effects and all. So it is important that the early diagnosis is made to contain the spread. And imaging plays a very crucial role in that aspect. So in radiology, in EndoCheck program, we use a high resolution endoluminal ultrasound, which is a transvaginal ultrasound. So it is a radiation free, very easily available, non-invasive technique, and any women can undergo this without any hassle. So this gives good detail about the endometrial thickness. We actually measure the thickness. We have a criteria for premenopausal, postmenopausal. So there is a cutoff, size cutoff, above which we have to be suspicious. So this gives details about the endometrial thickness, how the endometrium interface with the adjacent organs, if there is any invasion or spread. Those subtle details can be understood. And as we know that cancer actually causes increased vascularity, blood supply. So all those blood supply, extra blood supply can be easily picked up using Doppler methods. And these suspicious patients are then subjected to biopsy. So it's referred to the gynae onco. So they counsel the patients and probably do an hysteroscopy and biopsy. And if it is proven, again the role of radiology becomes very important. So in a proven case of endometrial CA or ovarian CA, we need to stage the disease. So we have very good diagnostic options like MR and PET CT. So which gives both the local staging of the disease as well as spread to other organs. So we can holistically assess at what stage the disease is. So that is very important for the management option. So radiology has very key role in the early diagnosis, in staging, as well as in post-treatment follow-up. So it is important that patients are aware of these high-end investigations, which are easily available at Apollo centers.
Members of the media, my friends and colleagues from Apollo, the medical fraternity. It's a beautiful day and it's also momentous. A couple of years back, we set out to do what is called as cancer management teams with a single intent that if no two cancers are the same, why is it that you're going to the same oncologist who treats multiple cancers? When we set out on that journey is when we started talking to Dr. Rani Bhatt, a very senior gynecologic who has dedicated a lifetime to actually focus only on gynecology. While we did that, and we also figured out what technology could do, data could do, AI could do and enable, whether it's a robo or whether it's IPEC or PIPEC, cytoreductive surgeries or oncofertility, what got us thinking is what do we create as a product line to be offered that anybody could go to the neighborhood and get done. So the EndoCheck program, though being introduced by Apollo, can be actually done by any radiologist or sonologist who has an ultrasound machine, and there are thousands of them in Bangalore. And while we do this announcement today, it is just not restricted to Bangalore. It's a pan-India program which we launch. But after the diagnosis, what would you do for a cancer which today does not have a vaccine? Fortunately for the gynecological cancers in the cervix and those which are affected HPV, there are vaccines. But in endometrial and ovarian, there's a small, very small, negligible indication of squamous cells on the ovarian and the endometrium, which you can maybe in some extent get protection from a vaccine, which India plans to do in the vaccine program for cervical cancers, which is the HPV vaccine. The only option which is time tested for ages is get things done earlier so it's easier for you. And that's why we set out to do the screening program. One of the things we also envisage to do is you could get it done not necessarily at Apollo, while the Apollo network of clinics, maternity centers and hospitals are available for a lady who's of a certain age or has got a certain symptom or a certain risk to go to. Any hospital, nursing home or a diagnostic center today can provide an EndoCheck. So the Apollo team plans to partner statewide or nationwide to ensure that the person can get it done within the access point of their own living communities rather than traveling.